Hey, this is Dr. Weirs, and so following up from the last session that we were talking about fats and specific fats being precursors for things in the body, I wanted to expand a little bit more into that and wanted to go into specifically kind of the balance between omega-6 fat and omega-3 fat. And these are really probably I guess they get the most press, you could say. There's plenty of other different types of fats. There's omega-5s, omega-7s, omega-9s, things like that. But in general, there's two very important essential fatty acids that they call them essential because we have to get them from the diet. We don't have the enzymes to actually process these or create these fats on our own. And so we must get them in the diet, and the amount that we get in the diet determines how much our body has to work with, so to speak. So linoleic acid is the major omega-6 fat, and it is basically the precursor for a series of chemicals which, and there's more than just this, they're kind of fall into a family of chemicals called icosanoids, but that they're the prostaglandins and leukotrienes. And so in general, it's not completely 100%, but in general, the prostaglandins and leukotrienes that come from omega-6 fats are pro-inflammatory. There's one major exception to that, which is GLA, or gamma-linolenic acid. That's actually an omega-6 that is a precursor of an anti-inflammatory, but with the exception of that one, pretty much all the other are pro-inflammatory. So the more omega-6s you have in the diet, the more precursors your body has to actually be able to inflame or mount an immune response. So you need some, but you don't want too much. So then the omega-3 fats are kind of just the opposite. They're the precursor to prostaglandins and leukotrienes, but they are the precursors to anti-inflammatory prostaglandins and leukotrienes. So these are the fats that are actually going to turn off the inflammatory process. So what we think is that if you have the appropriate balance of 6-3 in the body, you can mount an immune response when you need to, but you can turn that immune response off when it's not serving a purpose anymore. And so some studies have suggested that the kind of typical American diet is probably 25 times higher in omega-6s than omega-3. So way too much 6, pro-inflammatory, and not enough 3. And so we think if you can just get that ratio more balanced, so typically most of us need more 3s and a little bit less 6s, that in and of itself will make your body a little bit less likely to inflame and more able to turn the inflammation off on its own. Also kind of wanted to go into the specific types of omega-3s that you want to look for, but actually I think I'm going to leave that to next time because we're probably getting up there in time. So, all right, so we'll see you next time.